One in three men over 50 has a pelvic floor problem, and most of them have no idea that's what it is. They think it's just aging. They think it's just one of those things. They don't talk about it. They just deal with it, quietly, alone, and usually getting worse. But here's what most men don't know. This is fixable. And the fix doesn't require medication, surgery, or a single awkward conversation with your doctor. You wake up at night, again, because your bladder won't let you sleep. You cut the trip short because you can't trust yourself to make it. You stand at the urinal longer than you should, waiting. You feel a little less in control of your own body than you did 5 years ago. That feeling? It's not weakness, it's biology. And there's a very specific reason it's happening, one that almost never comes up in a standard checkup. In a few minutes, I'm going to show you a set of daily exercises, backed by research, that directly address the root cause. Simple, free, and most men have never been shown how to do them correctly. Hi, I'm Dr. Hannah Blake. Before we get into this, I want to say something directly. The fact that you're watching this means you're paying attention to your health, and that matters. I've worked with hundreds of men over 50 who came to me frustrated, confused, and feeling like no one was giving them real answers. I'm going to try to be that person for you today. So here's what you need to know about your pelvic floor, and why the exercises most men attempt aren't working the way they should. As always, everything I share here is for educational purposes only. Please consult your doctor before making any changes to your health routine. Let me paint you two pictures. Picture the first one. It's 2 a.m. You're not sick, you're not in pain, but something woke you up, again. You make that trip to the bathroom, and on the way back you think, I used to sleep through the night. What happened? Picture the second one. You're out. A long drive, a family event, a hike, and somewhere in the back of your mind, you're calculating. How far is the next restroom? Can I make it? You used to never think about that. Now it's always there. These aren't small things. They chip away at your confidence. They change how you plan your day. And most men, never say a word about it. You're not broken. Your body is sending you a signal. The question is, are you listening? Now here's what happens if you don't address this. The pelvic floor is a group of muscles. Like any muscles, if they're not trained, they weaken. And as they weaken, the symptoms don't just stay the same, they compound. What starts as mild urgency can progress to significant leakage. What starts as a slower stream can become incomplete emptying, which puts pressure on the prostate, which makes everything worse. Research suggests that untreated pelvic floor weakness in men over 50 is directly linked to lower urinary tract symptoms that worsen over time, not just plateau. And here's the part that hits a little closer to home. This affects more than just your bladder. Men dealing with these issues report pulling back from activities they love, avoiding travel, feeling embarrassed in situations where they used to feel completely at ease. That's not just inconvenient. That's your quality of life, shrinking quietly. The truth is, most men deal with this alone. They assume it's just aging. But aging and neglect are two very different things. Here's what almost nobody's actually talking about. Most men who try pelvic floor exercises are doing them wrong. Not a little wrong, fundamentally wrong. They're targeting the wrong muscles, using the wrong timing, and getting maybe 10% of the benefit they could be getting. That changes today. Stay with me here. What I'm about to explain about the anatomy of your pelvic floor might completely change how you think about this for good. What I'm going to share next explains exactly what's happening inside your body and why the exercises your doctor may have briefly mentioned aren't giving you the full picture. Why? Think of your pelvic floor like a hammock strung between 2 points. When it's taut and healthy, it supports everything above it. Your bladder, your bowel, your prostate. When the tension drops, when those fibers weaken or lose coordination, everything above starts to sag. Not dramatically, gradually, without warning. That's what we're dealing with. And there are 4 key things happening in your biology that explain why it starts after 50. Mechanism 1. Hormonal changes and muscle fiber loss. Here's something most conversations about hormones miss entirely. Testosterone doesn't just affect your energy and mood, it plays a direct role in maintaining the strength and tone of pelvic floor muscle fibers. After 50, testosterone levels gradually decline. Research suggests by roughly 1 to 2% per year. That doesn't sound like much, but over a decade, it means the muscles in your pelvic region are operating with significantly less hormonal support than they were at 40. What you notice: weaker contractions, less endurance, less snapback after effort. The muscles are still there, they just need a different kind of stimulus to stay functional. Mechanism 2. The prostate factor. Your prostate sits right below your bladder and wraps around the urethra, the tube urine travels through. After 50, the prostate commonly begins to enlarge. This is called benign prostatic hyperplasia, and research suggests it affects the majority of men by their 60s. Here's what that means practically. An enlarged prostate puts pressure on the urethra. That pressure makes the bladder work harder, and a bladder that's constantly working against resistance becomes overactive. It starts sending urgency signals before it's actually full. The pelvic floor is the one system that can help manage that pressure from the outside in. Stronger pelvic muscles mean better urethral support. Better urethral support means fewer false alarms. Here's a number that genuinely surprised me the first time I saw it. Studies suggest that structured pelvic floor training reduces urinary urgency and leakage in men by up to 50 to 70%, without a single medication. Most men never hear that figure. Most doctors don't lead with it. But it's there in the literature, and it matters. In all my years working with men over 50, this is the one area that consistently gets overlooked. In checkups, in referrals, in general health conversations. Men are told to eat better, move more, manage stress. Almost no one hands them a pelvic floor protocol. Mechanism 3. The neural connection. Your pelvic floor isn't just muscle. It's also a communication network. The muscles have to receive signals from your nervous system to contract, coordinate, and relax at the right moments. After 50, nerve conduction, the speed and precision of those signals, can slow. What this means: your pelvic floor may contract when you don't need it to, or fail to contract when you do. That's why some men experience urgency with no warning. The signal gets scrambled. The good news? The nervous system is trainable. Targeted exercise doesn't just build muscle, it reestablishes those neural pathways. Research in rehabilitation medicine shows that consistent pelvic floor training improves coordination, not just strength. Mechanism 4. Posture and intra-abdominal pressure. This one's less talked about. When you sit for long periods, which most men over 50 do more of than they realize, your posture shifts. The natural curve in the lower spine flattens. That changes the angle of your pelvis, and it quietly increases downward pressure on the pelvic floor all day long. Think of it like this. Imagine a weak floor in a house, and then parking a car on top of it every day for 8 hours. The exercises matter, but so does understanding what's pressing down on this system while you're not exercising. This next part is where it all comes together. What I'm about to walk you through are the specific exercises, and more importantly, the techniques most people get wrong. Don't tune out now. And before the last fix, I'm going to share the one that most doctors never bring up. It's the one that ties everything together. 7 fixes. I've saved the most overlooked one for last. Fix number 7 is the one most doctors never bring up. But we're starting with something just as foundational. Fix 1. Finding the right muscles, the step most men skip. Before you do a single repetition of anything, you need to know you're targeting the right muscles. This sounds basic. It isn't. Most men, when they try pelvic floor exercises, tighten their glutes, hold their breath, or brace their abs. None of those are the pelvic floor. The pelvic floor is the internal group of muscles that control urine flow, not the ones you can see in a mirror. Here's the most reliable way to locate them. Next time you urinate, briefly try to stop the flow midstream. The muscles you use to do that, those are your pelvic floor muscles. Don't make a habit of stopping urine midstream, that's only for identification. But once you've felt those muscles engage, you know exactly what to target. Many men report that the moment they finally isolated the right muscles, they realized they'd been doing it wrong for months. Fix 2. The standard Kegel, done correctly. You've probably heard the word. Here's what it actually looks like, done right. Contract those pelvic floor muscles. Hold for 3 to 5 seconds. Fully release. That release is as important as the contraction. The muscle needs to relax completely between reps to build true strength and coordination. Start with 10 repetitions, 3 sets per day. The common mistake is rushing through the reps. Slow, deliberate contractions, with full release, beat fast, sloppy ones every single time. Research consistently supports slow twitch fiber training for pelvic floor endurance. Most men doing Kegels are squeezing the wrong muscles entirely and wondering why nothing's changing. Fix 3. Quick flick for urgency control. Standard Kegels build endurance, but urgency, that sudden, overwhelming, I need a bathroom now feeling, requires a different kind of training. Quick flick exercises train the fast twitch fibers in the pelvic floor, the ones that activate rapidly, on demand, when a sudden urge hits. Here's how. Contract the pelvic floor as quickly and fully as you can, then immediately release. That's 1 rep. Do 10 in a row, 3 times per day, separate from your slow Kegels. I had a patient, a 64-year-old man I'll call Roy, who added this one specific variation for 3 weeks. He came back and told me the urgency he'd had for 2 years had almost completely disappeared. His words, "I feel like I'm back in control." Quick question, drop a comment below and tell me where in the world you're watching this from. Seriously, it genuinely means a lot to see men from all over taking their health this seriously. All right, let's keep going. Fix 4, the long hold, building endurance where it matters. This next variation is the one most men who do Kegels never progress to, and it's where the real endurance gains happen. Once you're comfortable with standard Kegels, extend the hold. Work up to holding the contraction for 8 to 10 seconds before releasing. Fully relax for the same amount of time. Repeat 8 to 10 times. This trains the slow twitch fibers responsible for all-day support, the baseline tension that keeps everything in place during a long car trip, a meeting, a workout. The goal is not to feel the burn. The goal is to feel control. That's a different sensation, and with practice, you'll know the difference. Fix 5. The functional Kegel, training your system for real life. Here's what standard exercises miss. Your pelvic floor doesn't operate in isolation. It responds to real-world events, a cough, a sneeze, lifting something heavy, standing up quickly. Functional training means practicing a Kegel contraction before you do those things. Brace before the cough, contract before you lift. This is called the knack technique in pelvic health rehabilitation, and research suggests it significantly reduces leakage episodes. It's simple to practice. Anytime you anticipate a moment of physical stress, a laugh, a sneeze, picking something up off the floor, pre-contract the pelvic floor. Over time, this becomes automatic. We're not done. Fixes 6 and 7. These are the ones most people never hear about. Stay with me. Fix 6. Breathing and pressure management. Most men hold their breath when they exert effort, during exercise, during lifting, during anything hard. And every time you hold your breath and brace down, you send a spike of pressure straight into your pelvic floor. Over time, with poor breathing mechanics during exercise, you can actually undo your Kegel training by repeatedly loading a floor that isn't ready for it. The fix is exhale on exertion. When you lift, push, pull, or strain, breathe out. This coordinates your diaphragm with your pelvic floor and dramatically reduces downward pressure. Physical therapists who specialize in pelvic rehabilitation consider this one of the highest leverage changes a man can make. One man in his late 60s made this one change, just the breathing, and told me at his next visit, "I don't know why no one mentioned this before. I feel like I finally understand how my body is supposed to work." If you've made it this far, you're already doing more than most men ever will, and that matters. Nobody talks about this, but every pelvic health specialist knows it. The way you breathe during exercise is either protecting your pelvic floor or slowly destroying it. Fix 7, the one most doctors never bring up, positional training. Remember mechanism 4, posture and intra-abdominal pressure? Here's the fix. It's not complicated, but it requires you to actually pay attention to how you sit. When you sit for long periods, your pelvis tilts backward. The pelvic floor gets compressed and chronically loaded. Over time, this creates what's known as a hypertonic pelvic floor. muscles that are actually too tight. And tight, tense pelvic muscles have poor coordination. They don't contract or release on command the way they should. The fix has two parts. First, sit with a slight forward tilt of the pelvis. Think sitting tall, not slumped. A small rolled towel or wedge under the sit bones can help. Second, do one set of slow Kegels every time you sit down for a long stretch. Not as a rule, as a habit. You're retraining your body to associate sitting with pelvic awareness, not pelvic neglect. Research in pelvic physical therapy supports the combination of postural correction and targeted exercise as significantly more effective than exercise alone. Before I wrap up, there's one more thing I want to cover, because most videos on this topic leave it out entirely. What does realistic progress actually look like? Because I see men start these exercises, feel nothing after 2 weeks, and quit. And that's a shame, because they were probably right on the edge of their first real change. So let me give you an honest timeline. Weeks 1 through 4. This is the awareness phase. You're learning to find the muscles. You're building neural pathways, the communication between your brain and the pelvic floor. Most men don't feel dramatic results here. What they do feel is a growing sense of awareness. They start noticing when they're holding tension they didn't realize was there. That's not nothing. That's the foundation. Weeks 4 through 8. This is where most men start to feel it. Urgency episodes become less frequent. The delay between the urge and the ability to respond gets longer. Nighttime trips may decrease. Sleep improves. Many men report a feeling of greater stability, like something that felt loose is beginning to hold again. Research in this area generally shows meaningful improvements beginning at 6 to 8 weeks of consistent training. Not everyone, not every symptom, but measurable change in the majority of men who stay consistent. Let me ask you something directly. Have you ever noticed that your symptoms are worse after a day when you drank very little water? Drop that in the comments if that's happened to you, because there's a reason for it and it's counterintuitive. Weeks 8 through 12. This is the consolidation phase. The muscles are stronger. The coordination is more automatic. The habits have formed. Men who reach 12 weeks of consistent practice, 3 to 4 sets per day, generally report significant improvement across urgency, frequency, and nighttime disruption. And here's the part most men completely skip over: maintenance. Pelvic floor muscles are muscles. If you stop training them, they gradually lose conditioning again. The good news is that maintenance requires far less effort than building. 2 sets per day, done consistently, is typically enough to hold the gains. Almost there. And what I'm about to share in the story segment? This is the part that puts everything we've covered into a real human context. Don't click away yet. I want to tell you about a man I'll call Gerald, 62 years old, retired firefighter from Ohio. Built like a man who'd spent 40 years doing physical work, still active, still proud of that. And quietly, for about 3 years, he'd been dealing with something he hadn't told anyone. He'd stopped taking long trips, made excuses not to go to his grandson's baseball games, outdoor stadiums, no easy access to bathrooms, started sitting near the aisle at church, woke up 2 or 3 times a night. He didn't bring it up to me. I noticed it when I was reviewing his chart and saw he'd declined a referral for a hiking group connected to our clinic. I asked him directly, "Gerald, what's going on?" He looked at the floor for a second. Then he said, "I just don't trust myself anymore." We talked through the exercises you've just heard about. I gave him the full protocol: isolation work, slow Kegels, quick flicks, the breathing piece, and the positional adjustments for when he sits. We made it simple. Nothing he needed equipment for, nothing that required a gym. At week 3, he sent a message through the patient portal. 3 words: slept through Tuesday. At week 7, he came in. He'd been to 2 of his grandson's games. He'd taken a 4-hour road trip, without planning around bathroom stops for the first time in years. He still woke up once a night, most nights, but only once. He sat down in the chair across from me and said, "I feel like myself again. Not who I was at 40, just myself." That was enough. That was everything. I share this not to make promises, but to show you what becomes possible when you take the right steps, consistently. So here's what we covered today. Number 1. Your pelvic floor is a trainable system, not a fixed part of aging. The muscles, the nerves, the coordination, all of it responds to the right input. Number 2. Most men who try these exercises are targeting the wrong muscles, rushing the reps, or skipping the release phase. Technique matters more than repetition count. Number 3. The exercises that make the biggest difference are the ones that connect to real life. Functional Kegels before physical effort, breathing mechanics during activity, and positional awareness when sitting. Number 4. Meaningful improvement typically takes 6 to 8 weeks of consistent practice. The men who quit at week 2 are usually the ones who were closest to turning the corner. You're not slowing down. Your body is asking for a different kind of attention, and now you know exactly what to give it. One final thought. What we covered today is general health education. Every man's situation is different. Prostate health, bladder function, and pelvic issues can have other causes. Please bring this to your doctor. Tell them you want to discuss pelvic floor health. That conversation is worth having. If you learned something useful today, hit the like button. It genuinely helps this channel reach more men who need this information and aren't finding it elsewhere. Subscribe and tap the bell. I post new videos every Tuesday and Friday, and I promise they're always worth your time. And here's my question for you in the comments. Which symptom showed up first for you? The urgency, the nighttime waking, or something else? And have you ever been told by a doctor to do pelvic floor exercises? I read every comment. I want to know your experience. In my next video, I'm going to cover something almost nobody in this space is talking about yet. The specific sleep position that directly affects your prostate pressure overnight, and why changing it may be one of the simplest things you can do for better sleep and better bladder health after 50. You'll want to see it. I'll see you there.